I am going to now introduce our keynote speaker. I'm very excited to do so. Melissa Merrick, PhD, is President and CEO of Prevent Child Abuse America, which is the nation's oldest nonprofit organization dedicated to the primary prevention of child abuse and neglect. The Idaho Children's Trust Fund, as I mentioned before, is the state affiliate of Prevent Child Abuse America, and there are affiliates all over the country, every state. Melissa has nearly 20 years of clinical research and leadership experience related to the prevention of child abuse and neglect. Prior to being tapped to head Prevent Child Abuse America, Dr. Merrick served as the lead scientist for the Adverse Childhood Experiences, the ACEs study, at the Centers for Disease Control and Prevention for 8 years. She's been involved in a lot of journal articles on the subject and lots of information that we all use every day. Dr. Merrick has an incredibly impressive resume, and you can read more about her on the Padlet. We have all the biographies listed there. We are so fortunate, I would say so fortunate, to have her as the director of Prevent Child Abuse America, leading that national organization with her vision and passion for this work, and is bringing, I think, a new vitality and a new vision to PCAA for the possibilities of preventing child abuse and neglect. Melissa, in her bio, tells us that she's married, has 2 young kids who keep her grounded, thankful, and hopeful for a brighter future for all children. We are also very fortunate to have Melissa Merrick as our opening keynote speaker for our 2021 SFTI. So here she is, live from Chicago to our homes and offices from Sandpoint to Salmon. Please welcome Dr. Melissa Merrick.
Hi, everyone. Thank you, Roger, for that kind introduction. I wish, like everyone else, that I could be with you in person, but soon enough. I'm feeling very hopeful. I also think it's so important in this time of physical distancing that we really stay emotionally and socially connected. And it's wonderful to have opportunities like this to convene via Zoom, albeit while I have children at home on Zoom and my husband working on Zoom. So sometimes the internet doesn't cooperate with our intentions too, but those deep breathing exercises help. So we hope that this will go smoothly, but if not, folks have my slides and we can make those available to you. But I'm just really thankful to have the opportunity to talk with you all today about really the power of prevention. And I'm thankful to Roger and his great leadership in Idaho, again, as the executive director of the Prevent Child Abuse Idaho chapter, which is the Children's Trust Fund. I'm also thankful to the governor's Children at Risk Task Force for co-hosting this meeting and to be among 235 of you so early in the morning. We are a passionate bunch in this field, I know. And so I think I'm going to try to share my screen here. And I think what I'd like to do is to first just say maybe a thumbs up if you can see this. I think people can see this. Okay, great. The power of prevention. What do we mean by prevention? Obviously, like Roger and others have said, we need a prevention continuum in this country. So we need to be preventing child abuse and neglect before it occurs. That is what we would consider primary prevention. But certainly we need to mitigate risks for children and families once early adversity has occurred. That way we can really put them on trajectories still to health, well-being, prosperity. You know, we know that the things that happen in childhood can really last a lifetime, but we mean that both on the positive and negative. So we really want to get a lot of the good prevention stuff, right, in children's families, in the communities, but really in society at large. So really the context that supports children and families is really powerful, and it's going to be a lot of what I share with you all this morning. But for me anyway, it's always helpful to understand the wonderful work that has come before us, and that really sets the foundation for what can we really achieve together for the next generation. So with that kind of historical landscape in mind, I'll just share, let's see, is this working? Okay. So if we consider a generation as 20 years or so, you can see that the topic of child abuse and neglect, even being in the public sphere, even for people to understand what we meant by child abuse and neglect, only goes back, 3 generations. So in 1962 was the landmark paper, The Battered Child Syndrome, authored by pediatrician and pioneer of this field, Dr. Henry Kemp. So really the first one to really articulate that there is this problem of child abuse. What are the signs? How can pediatricians really be part of identification and early identification to really keep kids safe? So really, I would say that this 20 years really was around having people understand that child abuse happens. Child abuse and neglect happens in families. Donna Stone in 1972, she is the founder of what is now Prevent Child Abuse America, of which I'm the CEO and president. But really, again, raising visibility with this nod to, gosh, I didn't know that this was happening in families. We really need to bring awareness. And then you can see the first Surgeon General's report came out in 1979 that really even said violence is a problem for health and well-being. So this 20-year period really just raised awareness. And I'm sure no one will be surprised to say that people like all of us, advocates, people that heard these messages, that understood what was happening in families, we went straight to intervention. We went straight to, oh gosh, we don't want this to be happening to children. We want to have services to, treatments and other things. And I share this in full disclosure that I am trained as a clinical child psychologist. That's what my PhD is. I'm licensed. And so helping one family at a time, once they've experienced abuse and neglect, is always going to be critically important work. And certainly that's the work that I did long before I really discovered public health or discovered what true primary prevention was. So, we again saw ad council campaigns, big, huge, multi-million dollar PSAs featuring taglines like this: take time out, don't take it out on your child. Again, furthering the awareness, but really moving to intervention. So Healthy Families America, that is Prevent Child Abuse America's signature evidence-based home visiting model, in 1992 was the first time that Healthy Families America was available for families in 22 states. Again, more to help parents, cope with having a newborn, having young children, prepare them to be able to cope with stress and manage stress, engage in positive discipline strategies. And the landmark ACE study came out in the late 90s. This was really, I think most of you on the call today know the ACE study, but the original ACE study was a partnership between CDC and Kaiser Permanente, a large HMO out of San Diego, California. And it really just, among adults, it retrospectively, so they had to report back into their childhood how many experiences of abuse, neglect, and various forms of household challenges did they experience as a child. And I think my screen stopped sharing, so I'm going to try it again. But basically, raised awareness. And really, though, the ACE study, what makes it so compelling, even today, is that ACEs were common, even among a very have population, if you will, mostly white, mostly well-educated, all insured by nature of being an HMO sample. But ACEs were common. 2/3 of people had at least an ACE score of 1. Across multiple studies, if you have at least an ACE score of 1, you're about 85% more likely to have additional ACEs, because we know that these kinds of risk factors tend to co-occur in the same families. But not just that ACEs were common, but also that ACEs were associated with adult health problems. So chronic disease problems, leading causes of death. The more ACEs you had in childhood, the higher your risk was to have a whole host of negative health outcomes. So this all happened sort of in the intervention generation, if you will, which then led to really understanding where we needed to move next, which was around building evidence and the public health imperative. If these things that could happen in childhood could really predict later cardiovascular disease, the -- cause of death in this country, diabetes, stroke, if those outcomes were, the foundations for those outcomes were set in early childhood, then what could we do to kind of prevent those foundations? What could we do to truly create the conditions for health and well-being? But to say how new this is, it's only in 2001 that the CDC, the leading public health agency for our country, received its first ever congressional appropriation for child abuse and neglect. And it was a very small appropriation. It remains very small, but only in 2001. And then you could see that in this generation, if you will, 2006, the Center for the Developing Child at Harvard University, John Shonkoff's work, really helping us understand the impacts of early adversity and toxic stress on the brain architecture, even how our immune systems or endocrine systems function, and frankly, even how our genes express themselves. Again, those linkages have such strong evidence now. So it makes it even more important that we take on this public health approach. And a public health approach is really defined as what we can do collectively to assure the conditions in which all people can be healthy and can thrive. And this, I just want to dissect for a moment. Again, it says what we as a society do collectively, not one agency or organization or one discipline alone by itself. Prevention can only happen in partnership, and public health really honors that and says it's what we can do collectively to assure the conditions in which all people can be healthy. So going back to what I skipped here, basically the first 3 generations really have set a strong foundation for the next generation of this work, which is really around how do we all come together? We all have a role to play. I think Roger said that clearly, no matter what your role is, and many of us have multiple roles, right? We wear multiple hats. I wear the hat of mom, of community member, of business person, of, scholar. And in all of those roles, and all of those hats, I have a role to play in prevention, making prevention the priority. And again, yes, I mean primary prevention, stopping abuse and neglect before it occurs, but I also mean the whole full prevention continuum, which needs all of us and all of our many, many partners and stakeholders and friends in this work. So public health, what we as a society do collectively to assure the conditions in which all people can be healthy. I mean, coronavirus gives us a really palpable understanding of this sometimes very abstract definition. It's just like, early in the pandemic, especially if, I wore a mask, but my neighbor didn't, it wasn't as effective at protecting everyone. If we all needed to do it to really, curb the spread of coronavirus, this and physical distancing and all of those kinds of measures, I think some of us for the very first time are seeing public health in action. So what can we do collectively to assure the conditions in which all people can be healthy? I hope people have seen this slide before, or this concept of the pair of ACEs. I will review it briefly only because I think it's a really nice visual at helping us understand what do we mean by the conditions, right? I mean, do we mean structural and social determinants of health? Yes. Do we mean root causes? Yes. And I think in this graphic you can see. So here the leaves are really depicted as those traditional ACEs, if you will, that we measure. So, growing up in a home with mental illness or emotional and sexual abuse, substance abuse in the family, witnessing intimate partner violence in your family, physical and emotional neglect, parental separation or divorce, parental incarceration. So all of these sort of traditional ACEs are the leaves. But we sometimes in this ACEs field, and as we bring awareness to these things, we almost think that these things are inevitable. Like, oh, well, we assessed and measured ACEs in this family. So again, intervention. And I would just have us look here that there are all these roots, right? And you could put historical trauma in there. I've seen ACEs, that acronym, be used for adverse colonial experiences. So really, thinking about things that happened many, many generations ago that stay with us. Again, in how our genes express and how we interact with our environments, right? That set the foundation for the kinds of leaves that we observe. And I would just like to take a moment to say that parenting in this context with these conditions is extremely difficult anytime. But parenting during a global pandemic in this past year, it can really, I hope it's a time that we are all developing empathy for one another, to recognize that we all families need a little bit of support sometimes. And then other families need more support or different support, and it's all okay. It's that we all have a role in keeping children and families strong. And so again, I'm thrilled to be at the Strengthening Families Training Institute, because I think it is so clear to the science, because we know that children are safer with their families than from their families when those families are supported in communities. Okay, so parenting is always challenging. Navigating these conditions is always difficult, and we need resources and supports, concrete supports, and other kinds of supports for families always. But the conditions this past year, the job loss, the lower wages, the instability, right? Unpaid leave, right? So people couldn't even afford early in the pandemic if people would have taken sick leave. But if they didn't have sick leave and they went to work sick, right? This is part of what perpetuated some of the spread early on. So this is like a really acute stressor in this time. Obviously, we also have another public health crisis before us, this acute racial and civil unrest in the backdrop. Certainly, living in Chicago, we had, after the murder of George Floyd, we had some fires in Chicago, which made our office space be unsafe. We were already out of the office, working from home, working remotely. But when you add in these other things into the backdrop too, not to mention the discomfort that comes from these gross inequities being, you can't bury them. They are so clear, and it has brought so much awareness. And something Roger said, I think we have to, as a field for sure, but I think as a people, start getting more comfortable with uncomfortable conversations, because that's the only way that we're truly going to make change. If we do what we've always done, we're going to have what we have. So not to mention the gross, like so many natural disasters this year, wildfires and hurricanes, just additional sources of stress and trauma and toxic stress for children and families in this time. Not to mention, again, the digital divide and the unusual circumstance, where I know how stressed I am every day as a mom, working from home, having kids try to learn from home, and feeling less than that I can't really maximally support them if I'm working and all of that. But that's recognizing that we have the great privilege of having internet and having jobs and being able to access childcare and all of these other things that really are not equally available to different families. This is a family that is, their internet at home wasn't working, where they didn't have strong broadband, and they're, working from a fast food restaurant to try to navigate virtual learning. For kids that were able to go back in person, obviously school doesn't look quite the same as it did last year this time, or last year 2 days ago, because I think by the 15th we were all kind of out of school across the country. And then just, again, the competing caregiving demands and childcare, the social isolation, the unavailability of health insurance, or not feeling safe to access mental health care, right? In this time, there was so much uncertainty in this year. And when you think about it, it's like the perfect situation. So much stress is so high. Again, in this time of physical distancing, people were not as able or as as able to really access their emotional and social supports as they were before the pandemic. They, if your stress relief was going to a gym, well, gyms were closed, right? If your stress relief was taking the train and having a moment to think, you're not on the train right now, or whatever. So it was this, perfect storm, really, of super overload on our families, on our parents, right? So taxing, just trying to make ends meet and try to stay employed or stay, being able to pay the rent and be there for your children. But then, every choice you have to question, is this the right health choice? Am I following guidance? And what is the guidance today? It has been all over the place, and the way that it's been communicated and such. So that, and then kids out of school, where we know a lot of those mandated supporters, that interact with kids are teachers and principals and custodians and janitors and bus drivers, are not connected with children, right? So we're not able to understand if a family needs additional supports in this time. I will say that early on in the pandemic, though, lots of media inquiries around, is child abuse increasing, and of course we know that our surveillance any time of the year is imperfect, right? Our data systems are imperfect. The way that we count Child Protective Services reports versus substantiated reports, we know that's just but a tip of the iceberg. That said, we know that most families are just trying to do the best that they can, and that all families want to be good parents. I mean, I truly believe that parents, were just trying to do the very best we can, but we need help. We need help. We need people, or the context and the societal landscape to support us making good parenting decisions. And so, Wendy Ellis and her colleagues that did the original pair of ACEs graphic that I showed, updated it during COVID, to expose these additional, not just adverse childhood experiences that are happening in a family, but then these adverse community experiences that are happening in directly related to COVID-19. And I've heard people call it adverse COVID experiences, right? So that ACEs acronym. Again, but food insecurity, lack of access to primary care and screening, let alone the unemployment, higher rates of mortality, all of these things. So the conditions are ripe for things to go wrong. And so what do we do as a field? Again, in the next generation of this work, where we're saying we're making prevention the answer, right? We are really trying to champion and harness the power of prevention. It really means that we need to look at the ACEs study and what it tells us, that no matter how you measure ACEs, and no matter what your health outcome of interest is, if you have higher ACEs, you're more likely to have enter a mental health problem here, maternal health outcomes being more poor, infectious disease, health risk behaviors like opioid use and misuse, right? Suicidal ideation and suicidal attempts. It can even impact, of course, because of its impacts on the brain architecture and brain functioning, can affect whether kids complete high school, right? Whether you're employed as an adult, whether you live as an adult in poverty. So these strong associations, and again, there have been over 42 health outcomes that have the same pattern, that as your ACE score increases, so too does your chance of having those health outcomes. But if you add and overlay parenting during COVID and all of those adverse COVID experiences and adverse community experiences and lack of access to social and emotional supports, which we know are such strong protective factors for children, it would be even more impactful. And we know, again, outside of a COVID landscape, that if we were to prevent ACEs, that translates to preventing up to 21 million cases of depression, up to 1.9 million cases of heart disease, and up to 2.5 million cases of overweight or obesity. So this is a graphic from a CDC vital signs report that I was the first author on. It came out in late 2019, but we looked across 14 health outcomes. So you can see the health conditions there, the health risk behaviors, and various forms of socioeconomic challenges. And this graphic just says that across all of those, if we were to prevent ACEs in a population, we could prevent depressive disorder by 44%, asthma 24%, right? Diabetes 6%. I mean, huge impacts. Unemployment 15%. So it's an important public health lever and an important way for us to think about prevention, that ACEs are not inevitable. We have prevention solutions for ACEs, and we're going to get there in a moment. So if we as a field could really bring more awareness to these impacts, but then the so what of it is, then we need the prevention landscape to support, the prevention of ACEs. It's not just we need to train everyone in a state on ACEs. Of course, I think that that's super important. We should all have this grounding in the science. But I hope that we're training on ACEs so that, when we see a child acting out, or what we would say is acting out, or experiencing internalizing problems in a classroom, we could think, what happened to them, right? Maybe it is their trauma. But I also hope we're using the ACE data to say we can prevent these negative downstream health impacts if we invest upstream early in keeping families strong and communities thriving. And we'll talk about that in a moment. And lots of people are writing about this now. And as Roger said, the Thriving Families, Safer Children movement, which we'll talk about in a little bit as well. Really, there has been a movement budding for years and years, right, around child welfare versus child and family well-being, right? So removal versus keeping families strong together. This is really the kind of balance. And I don't know what the answer is in terms of, there's some people that want to know, should we just transform child welfare to include prevention? Others suggest we should have a parallel prevention system and leave the work of child welfare to child welfare, so there's, and hopefully by having a prevention system, we would have less children involved in the child welfare system. That's, I think, a topic that is really hot right now. I would say that I think there are many, many, many things that we can be doing outside of a traditional child welfare system, things like family resource centers, things like evidence-based home visiting. I'll show you some evidence-based strategies in a moment, but really the time is now. So we know the landmark ACEs research and what it tells us. We understand the overlay of the pair of ACEs and those root causes. And then we understand the overlay of COVID and this acute time of increased overload of stress and stressors on families without that same infusing of protective factors and protective context. And that is really makes this moment super urgent for children and families. So then what is the role of public health in violence prevention? It is about that primary prevention. So if you look at this left side of the graphic, that's what we mean, stopping violence before it occurs, thereby stemming the flow of children and families that touch these other systems like criminal justice, child welfare, social services, even healthcare. This is not meant to say that primary prevention, again, is the be all end all, right? We need a both and. We need prevention, primary prevention, secondary, tertiary. We also need trauma-informed responses, trauma-informed schools, systems, to really fill out that prevention continuum. So I'm glad that is a conversation that you all are having in Idaho. I think it's so important to understand that it's not a one size fits all. That said, if we are going to have the highest potential for population level impact, we do need to be thinking about the socio-political context and the policy level strategies that can really set the foundation for health and well-being and thriving. And that's what we try to do at Prevent Child Abuse America. Our mission is really to prevent the abuse and neglect of our nation's children, because we envision a world where children grow up happy, healthy, and prepared to succeed in supportive families and communities. Now, that work, especially now, recognizes that equity is not part of the work. It is the work, right? And so we have to have an equity lens in everything we do. That's in our programs we have to be thinking about equity in our policy level solutions, of course. And we have to, again, get comfortable with the discomfort that is necessary to really do better for children and families. You know, I loved that the question to start us off was not, what are we going to do when we go back to normal? Because I just don't think that there is a going back to normal after this time that we've experienced. I think we have to do better than normal for children and families. We have to set the foundations and the conditions for health and well-being and thriving. Through at PCA America, we do that with these 4 strategic pillars. So Healthy Families America, I've already mentioned, that's our evidence-based home visiting program. We're in about 600 sites in 38 states and DC. With that policy, Cam is going to put in the chat, we have a federal policy agenda and a state level policy agenda. So that really guides a lot of our advocacy work on the Hill, but also how we interact with and help educate other key stakeholders in these topics. You know, a lot of people, like I squarely see myself as a child person, right? I'm a child psychologist and I'm in this work, you know, because of children. But so sometimes, you know, if I talk to a new partner, or a business partner or a media partner, they may not see themselves in that same way. So then it's our job to articulate how having healthy children and in healthy families and supportive communities really helps them achieve their goals. So if you're a business leader, you're going to have more prosperity, more, you know, people are going to come to work prepared to work and be more focused. If you have on-site high quality childcare, right, you're going to have higher retention of good talent. You're going to have moms returning to work after maternity leave at a higher level if you invest in the good parenting stuff again. So you may not see yourself as a child person, but these child and family conditions, they're the workforce of tomorrow, right? So we want healthier brains. We want healthier kids. Public engagement and impact. This is, of course, we're still always raising awareness and commitment, but I would say we're also in the business of changing norms and really understanding what the norms are in this area. And then we do this work again through our state chapter network, our nationwide state chapter network. And we're just so proud that Roger and his team, all the work that they do for the children in Idaho. Again, this is like, you know, PCA could have a vision, PCA America could have a vision, but if we didn't have people actually in states doing the good work, then, you know, we wouldn't be able to bring back the evidence to then inform, you know, this is an iterative process, what you all share with us about what has worked in Idaho, what hasn't, what have been the challenges, how do you interact with your tribal partners and how, you know, and what are the barriers there? All of those things are really important because then we have research and evaluation across these 4 strategic pillars to really, again, help move the mission of and the vision into the next generation. And the good thing is, like I mentioned before, and I'm sure you all know, we can prevent ACEs. Like we have data, we have evidence-based strategies. And here you can see 6 of those evidence-based like buckets, I would call them, in blue from the CDC. For folks that are interested, the CDC has these kind of technical packages they call, they're based on the best available evidence. They have one specific to all the violence topics that they research. So they have one for child abuse and neglect by itself. This is the broader one about ACEs. There's also one on preventing intimate partner violence, preventing suicide, preventing youth violence. But the key ones here, strengthening economic supports for families. Let me just tell you that is one strategy that appears in all of the technical packages. So we know that providing concrete supports to families, having family-friendly work policies, strengthening household financial security, it just works by taking a little bit of that overload of stress off of parents so that they could really come with their fuller selves to try to implement positive parenting strategies and practices. The second bucket, promoting social norms that protect against violence and adversity. This is an important one too, but I would say that this is one that has really been understudied in our field. You know, I think the dominant narrative is, oh, it's that bad mom or that poor family who maltreats their kids versus the norm that we'd like to lift up, that we all have a role to play in keeping children safe and strong and thriving. So that we have work going on there, ensuring a strong start for children through evidence-based home visitation, like Healthy Families America, Parents as Teachers, Nurse Family Partnership. I will say across the 10 leading evidence-based models for evidence-based home visiting, we're only meeting 3% of the families who could benefit from early childhood home visitation, 3% across the leading 10 models. So this, if this doesn't say that we need to be expanding home visitation in this country and the availability of voluntary home visitation, I don't know what will. High quality childcare, of course, this childcare has been such in the media right now, because in this time where parents can't access childcare, they can't work, right? And so if they don't have childcare, they can't work. It's a cycle. And so, but not just the availability, but the availability of high quality and affordable childcare is also something that needs, we need to be advocating for. And then the bottom three buckets, I'm not going to go into detail right now, because I think this is what we've done as a field for generations already. This, I think, in the intervention generation that I said from the 80s to about the 2000s and still now, these are the things we most do. We do the parenting programs and, treatment and mentorship programs, after school programs, all super important. So please understand that I think, and the CDC recommends, that truly to be engaged in comprehensive prevention, we should have efforts in each of these buckets. So this is not an either or, but I think we are still trying to build the evidence and make the top three buckets more prominent, because they have the potential for more population level change. And we see prevention happening in communities around the country. And this is the kind of nod to the Thriving Families, Safer Children work that Roger mentioned. Again, there was something about this moment that provided a real opportunity to shift the narrative from child welfare to child and family well-being, and really how it takes us doing things differently. So this is really a national commitment to well-being, where 4 national partners have come together to say, none of us have all the answers. And obviously we need many, many, many more partners to get closer at having more solutions. But how could we come together across public and private sector? So this is a partnership between Prevent Child Abuse America, the Children's Bureau, so that's child welfare for our country, and the Administration for Children and Families, Annie E. Casey Foundation, so philanthropy, and Casey Family Programs, which is like a really large technical assistance provider to child welfare systems. How could we come across all of our 4 national organizations to say, we are going to invest in communities, yes, but we are going to lift up the expertise in communities. We are going to have youth voice and family voice and all of that lived expertise. And we are going to engage traditional and non-traditional partners, so newer partners to this work, business, media, faith-based organizations, just everything in a community to co-design really what is possible in prevention. And this work, it is really unfolding as we start. There's no separate appropriation right now for this work. And we're just trying to leverage the resources and expertise that the 4 national partners have, but also what the communities have. So in round 1, I would see this as sort of like demonstration sites. There were 4 sites selected, and they receive really intense technical assistance support to really think about how can you create a child and family well-being system. And then in round 2, we selected 18 jurisdictions, and Idaho, of course, is among them here, to really focus on policy or system reform at a state, tribal, or territory level. So really, again, we are looking to co-design what truly creating a prevention system could look like. We understand there will be pieces that will look the same no matter where you are. There were pieces that will be really unique, for example, to Idaho. Idaho might look really different than New York or California, right? But maybe regionally has some similarity with some neighbors, right? We're trying to figure it out, but it's a really exciting time to really come together in service of this broader mission to what can we do to set the foundations for health, well-being, and thriving? How can we, again, honor the strong evidence that shows that children are safer with their families than from their families when their families are supported? And really to make the case for the policy strategies we need to make sure that children have safe, stable, nurturing relationships and environments, we really need to widen the lens to include the factors that shape those environments. So these are 6 recommendations from a new Frameworks Institute report on how should we be messaging child abuse and neglect. So Prevent Child Abuse America had commissioned the initial frameworks report back in 2004. And then recently we partnered with the Alliance for Strong Families and Communities to update the recommendations. And you can see the link there, and I think it might be also in your chat. And also there's going to be a webinar that'll also be put in your chat on March 22nd that the primary author, Dr. Julie Sweetland, will go through these recommendations. But in general, it's really to highlight the collective responsibility that we all have for keeping families and children safe and thriving, and to really offer a sense of realistic hope, right? This is not deterministic, right? We know what we can do to prevent an overload of stress and stressors on families, and we should never talk about adversity or child abuse and neglect without talking about resilience. So I'm so thankful for a Resilient Idaho documentary and all of the themes that come out in it that really, again, balance. Again, our new tagline for Prevent Child Abuse America is that childhood lasts a lifetime. But it's so true in the positive and the negative, right? So like, how can we tip the scale and have more positive childhood experiences? Actually, not on this slide, but something to share. We recently, lots of folks, the American Psychological Association, lots of research labs have done surveys during this time around parenting during a global pandemic. And we also did one together with our partners at the American Academy of Pediatrics and the CDC. And what we found was that, yes, like 60% or more of parents were super stressed out in this time, parenting, and specific to navigating this kind of virtual or hybrid learning models with their kids while working or not working was really stressful. But of the people who really were stressed out, a lot of people, like I think 60%, also said it was a time of great closeness with their children. It was a time to spend more time. Like even for myself, I wasn't traveling anymore, and I was traveling every week before. So it was just more time together, right? And it doesn't mean that it wasn't stressful, but it can be stressful and you can have positivity at the same time. So I think that to me is very hopeful, because it first of all, it's true to, I think, our lived experience, but I think it also shows that if we just have more positive stuff, right, and less negative stuff, then we tip the balance toward positive outcomes. I mean, it really can be that simple. Of course, it's very complex given all the context and such, but we should never talk about adversity without talking about the power of resilience. And we should always include a proven or promising policy solution, again, because we know that policy level solutions can make the most population level impact. So in the spirit of policy, I hope you all have not missed this landmark historic investment in children and families, the American Rescue Plan Act, having $150 million in maternal, infant, and early childhood home visitation, or MCV funds, emergency funding for MCV, $250 million in community-based child abuse prevention, Title II funds, so CBCAP, that's the good prevention stuff, and we'll talk about that in a second, but $250 million in community-based child abuse prevention is a 400% increase in funding over the program's FY21 appropriation. So that's a huge increase in emergency funds. $25 million for childcare providers, $15 billion to help families pay for childcare. And this is, of course, just some of the things that are good for children and families in this, huge $1.9 trillion relief plan. You can see, of course, essential unemployment benefits also included there. The $1,400 in direct payments, obviously that gets a lot of news. But this expansion of the child tax credit is really huge. It's going to provide more funds for families, again, reducing that financial stress that is just yet another stressor. And again, always remembering back to the ACE science, it's not that, one ACE is worse than another or whatever, it's that cumulative impact, right? And if the more you have, the more likely to have all of these negative health outcomes. So how can we buffer that we're not overlaying other stressors, whether we define them as ACEs or not? We know that there are other stressors that probably operate in much the same way. So how can we lessen that load for families? Just to dissect this a little, the CB cap represents the main federal investment in primary prevention. And in 2019, it was funded at $55.6 million. And in 2020, it received a $16 million increase, but it was the first increase in 15 years. So now when I'm saying that, this $250 million is huge, it's because we were so thankful even for this small increase back in 2020. But even at that level, you can see we were only investing 82 cents per child per year. I'm sorry, but that is really shameful. That is shameful. 82 cents per child per year. It's, anyway, CB provides grants to all 50 states to meet the needs of communities and are carried out by public-private partnerships. So really people use, and certainly, you all know about CB in your state, but, people use the federal investment to really leverage state and local dollars, right? To really, again, bring more visibility to the landscape, to the conditions. What are the things that we need in a community to really prevent child abuse and neglect before it occurs? Funds are allocated to states based on the number of children under age 18 in each state. And let's see, it could be distributed to states within 8 weeks. So some of the guidance is just coming out. Again, was just signed into law last week. So we are excited about this historic investment, but we're going to have to see the particulars here in a second. But CB cap is really flexible, right? It lets you, as the CB cap agencies, really decide what is needed in your own communities. So it allows for you to provide comprehensive support for families, increase family stability. That could be through payments to families, support needs of families with, children with disabilities through respite or other activities. Certainly a whole suite of mental health, substance use, domestic violence services, these kinds of things, family resource centers, evidence-based home visitation, you can draw down CB cap funds for. Here's an example of just concrete, like what states used it for using their 2019 dollars. So you can see some went to Healthy Families America in some states, some used their CB cap funds to support whatever programming they had for Child Abuse Prevention Month, again, as a way of raising awareness and visibility. Concrete supports provided through baby pantries, mandated reporter/supporter training could be used, ACEs training, family resource centers. So again, really not pigeonholed. I will say that the one or some cautions around these monies, again, this is emergency funds. It's you have 2 years to spend it. So you certainly wouldn't want to use these monies to stand up a brand new program, because then what's the sustainability once the money goes away? That said, we are always at PCA America, and all of our national partners and such in this space are advocating for a huge investment in CAPTA, our CAPTA Child Abuse Prevention and Training Act and Treatment Act, where CB cap lives under. Our CAPTA reauthorization request is $750 million. But that said, you never know what's going to happen. But obviously, we think this is great. This is historic, but we need more. We need more prevention dollars to really set the foundation and the conditions for health and well-being for children and families. Here you can see the estimated CBCAP state allocations. So the average funds are estimated to range from about $200,000 to about $29 million, with a median of $3 million per state. And you can see Idaho there. So your 2020 CBCAP allocation was a little over 200,000. And these emergency funds, with the 6% that we took out, again, these are estimates. We have not seen the official guidance, but we anticipate you would be getting something around $1.4 million. So a huge increase, and it's so exciting. I can't wait to hear from Roger and others about what you're going to do to use these funds. When Roger and I were speaking in preparation of this, I liked how he described these dollars as, this could be like a little bit of a down payment on truly standing up a child and family well-being system. What are the resources in the community that you need, whether it's family resource centers, evidence-based home visiting, and that you already have, that you can invest in this time to really then see what strides you make when that's more available to families, right? When help seeking is less stigmatized because it's more prevalent and more people are accessing family resource centers or evidence-based home visitation. I think it's compelling. My chief research officer, Dr. Bart Klicka, he has 2 young girls, and he said he enrolled his family, and he's a social worker by training, and he, enrolled his family in Healthy Families America when his daughter was first born. And when he lifts that up and talks about it, it's like people are like, oh, well, he has a PhD and he needs help. And it makes it like, again, it normalizes help seeking. It normalizes that we're all just trying to do the best that we can do. And so how can we make that more available, less stigmatized, more accessible, of course, by all of the communities and families that could use that support? I also mentioned the McVie funds. A quick thing there is that these, the key allowable uses of those dollars are really for in-person or now virtual home visits. Again, all the home visiting models pivoted during this physically distant time to implement virtual home visitation, phone-based home visitation. So a lot of our work too had to be providing devices to families and giving them data plans and all of that stuff. So, those funds can be used for some of that, training for home visitors, assist families to acquire technology, and then providing families with the emergency supplies. Again, I think all of these funds definitely can be used for providing concrete supports, formula, diapers, food, those basic necessities that we know our families need, if they're going to be able to really devote their time and brain power to prioritizing positive discipline strategies, right? They need to not be overloaded with the burden of not being able to buy diapers or not being able to pay their rent. So the expected McVie funding distribution, you can see here. I won't go into great detail. But really, this is an exciting time. Prevention can only happen in partnership. I think what's wonderful is that this time, again, with this historic investment in children and families, also the foundation that has been set from the generations before us in this field, this time to really prioritize a prevention continuum, to really try to achieve a child and family well-being system. It takes all of us working together. This is our theme for our National Prevent Child Abuse America Child Abuse Prevention Month campaign, growing a better tomorrow for all children together. So really using that same kind of gardening imagery like the tree slide, every day we all help positive childhood experiences take root. So if you think about replacing those roots that we looked at, the historical traumas, the income inequality, the systems of racism and oppression, if we replace those with things like jobs, access to mental health care, safe, stable communities, more family resource centers, more evidence-based home visitation, all the good stuff. What are the leaves that we're going to be able to observe? They're going to be ones of peace and love and trust and health and well-being and thriving. But it takes all of us working together every day. And so please join us for CAP month. I know that Idaho will have a whole month calendar as well as nationally, but really to honor the power of positive childhood experiences and the hope that it provides. Dr. Bruce Perry is a psychiatrist. He's a world-renowned trauma expert. He sits on our national board of Prevent Child Abuse America, and he describes hope like this. He says, hope is like the ability to see a positive outcome no matter your current circumstance. And he says that the big difference is that for some of us, we could be in a really difficult, challenging situation like parenting during a global pandemic, let's say. But we know we can go back to our past experiences of when things have turned out okay. And where even if we were really stressed out, we came to another side. And that there are some communities, though, that they're less able to harness that hope because they just haven't seen that in their families. They haven't seen that in their communities. So how do we, again, lift up the lived expertise of everyone in the community, right? How do we really elicit and harness hope for people, for all of us? And I think it's really, to me, that's at the core of why we do this work, is really to really show that my children and my family will do better if all children and all families are doing better, right? And we sometimes honor that for our own families or our own small communities, maybe the children at my kid's school, but then those kids over there, we are less invested in. And that's the shift. The shift is we all together want to grow a better tomorrow for all children. And we know that it relies on all of us. So Bob Sagi, a pediatrician, also on my board, has another hope framework, and his is called Healthy Outcomes Through Positive Experiences. So he does a lot of this research on positive childhood experiences. And it's just fantastic when you can see that when you have positive childhood experiences, they operate much like the ACEs research does, right? The more positive childhood experiences you have, the more likely that you can overcome ACEs, that you can mitigate the risk conferred by ACEs and lead to positive health and well-being. So I'm just really thankful and appreciative for all of the work that all of you do every day. I feel hopeful every time I'm able to join a group like yours, because I know that together we can prevent child abuse, America, because childhood lasts a lifetime. Thank you very much for your attention. I will stop sharing and see if there's any questions or anything in the chat. I haven't been able to see your chat, so I'm pulling it up now.
And you can unmute and clap too. Thank you. Yeah, do people have questions? I'm going to ask one. I'll just start out. So, we're talking about this whole idea of a continuum, that we need everybody to be doing the work from, from the prevention side, through intervention, through dealing with, issues as they come at us, and then we can't do it without all of us involved. But I do feel like sometimes we operate in, silos. We operate in our own little boxes. What advice do you have for thinking through how we get to the part where we align what we do, as opposed to operating in our own little spaces?
Yeah, well, I think it's a great question, but it's things like this, providing safe spaces for people that are working in different aspects of the area, right? We need all of us to work together. I think it's also around operationalizing what we mean. So things like I've just found with my own board or with, our own partners, we start talking about equity. Well, that word maybe is so clear to me what I mean by equity, But it's really hard, if you're not always thinking about that, to know what you're talking about, right? So operationalizing it, showing that a forum like this that's inclusive of different perspectives and disciplines and voices and lived expertise is fostering equity. So I think whatever we can do to try to make it concrete for folks to understand. And look, it doesn't mean that your organization or PCA America or whatever will be the lead on all of the strategies that we're trying to implement, right? Some of the things we need to partner with other lead agencies, other things we know are squarely in our lane, and we are strategic and we have the right stakeholders to really be able to lead it and really propel that forward, then we should take the lead on those things. So I think it's really about balancing power. I think ego has to be out the window, right? We don't care who gets credit if the things that we want for children and families are successful. Sharing that credit with communities, with, again, those people that have lived expertise. We've tried this top-down approach for generations of this work, and again, we're always going to have what we have, right? Which is too many kids and families stuck in child welfare systems, too many children separated from their families, and too little investment in seeing families succeed. So if we think about those as like some grounding, priorities, and we, again, invite others with different perspectives, right? I mean, I believe that the prevention of child abuse and neglect is a nonpartisan issue, but I know that when you get into the specific policy level solutions, they can get really partisan really quickly, right? So instead, let us educate everyone about the science, about by having healthier kids, what do we have? We have less healthcare costs, okay? We have more prosperity, we have more productivity, and put it into language that people can understand. The one thing people will say to me, Melissa, I hear you talk all the time, but I never heard you say it like that. And it's like, well, yeah, because you can't just say the same thing to everyone that you're talking to, right? And that doesn't mean that you're all over the place. I am a little all over the place, but it means that your message changes. If you're talking to a business audience, you better come with some, return on investment data. You better come with some, prevention dollars, and let them understand $1 in prevention is $7 cost savings, depending on what you're looking at. You have to come ready. And if you're talking to clergy, you have a different voice. If you're talking to schools, honoring the amazing work that teachers and school systems are doing in this virtual time is compelling. But really honoring that it is our job as adults, as a community, as a society, as a state, as a country, to protect children. It is not up to children to protect themselves. It is up to us to take the collective responsibility to set the foundations and the conditions for health, well-being, and thriving.
This is Jane, and I'm glad you came to that last piece around the common language, because I don't know if you know it, but equity is a very hot button issue in Idaho, right? It's right up there. It's tagged along with the social justice agenda, right? It's the least thing that will move policy in Idaho right now. And so I think that it is all about that last piece of that conversation for you.
Yeah,
for us.
I think it's so important, Jane. Thanks for sharing that. Yeah, I think, again, you have to think about what we're trying to achieve, like what's our North Star, right? That we have healthier children and families. I think that's everybody. That's why we're in this work. That's why we're compelled to do this work. So for me, that might be called equity. And for others, that might be called concrete supports, or for others, it is taking a little bit of the edge off, this reducing the overload. I think whatever we can do to kind of make it a more universal experience. Again, I think one of the silver linings of this time must be that we are developing empathy for one another. It is hard for all of us trying to do this, so many things at every moment, not to mention the backdrop of extreme loss that we've all had in this country, in our own families, in the families we serve, in our communities. And it's really a heavy time. But if we are going to try to spark some hope, we can't kind of stay there when we're talking to others, right? We have to kind of, again, don't talk about adversity without talking about resilience, without talking about thriving, about what's possible if we break down the silos, if we partner intentionally, if we don't care who gets the credit, and if we don't politicize things that are not political. I mean, this is about health and well-being and stronger brains and a stronger workforce of tomorrow. I mean, I think it's stuff that everybody can get behind, but messaging is critical. Well, good.
I'm sure people have questions. Come on.
It's still early.
There's working in the courts and the childcare and in the schools. We got people from all the whole spectrum. So it'd be great to hear from people and what their there's a lot of chats thanking you. A lot of so appreciate that. But
well, good. I mean, I could keep on talking for hours and hours. So I'll just say that, none of this is possible without all of you, right? And so it's also not only thank you for the work you do, but I think, again, honoring how difficult it has been to do this work in this time is really compelling. I know that all of us, like my own team, myself, you always feel like because the moment is so urgent that you're not doing enough. But we have to give ourselves grace too. These problems that are before us, the leaves on the tree, they have been around for generations, right? So yes, I'm impatient like everyone else, and you want to see movement now, you want to see reduced rates now, but it could take a generation to change those trajectories, to change those outcomes. And so one thing I will say that I talk to a lot of policymakers about is we have never in our country invested in a whole generation of children. Our investments are made in the short term, 2 to 4 years, and depending on who is in office, whatever office, local, federal, whatever, they want to see impacts during their time so that they can get credit for it, right? And truly, if you look at other public health imperatives of our time, seatbelt use, tobacco, these have been long investments, and they've been huge investments, billion-dollar investments. We have such a small little fraction of money, and we're used to doing things on a shoestring budget. But one tribal partner of mine many years ago said, Melissa, if you show me your budget, I'll tell you what your values are. And so if we continue to only fund downstream health impacts, that's what we're going to have, right? That's where the funding is. If we move up and we just make a shift and just shift what we invest in prevention, what are the foundations that we're going to be able to achieve? So I think it's all of that. And now I see some questions, so let me.
I know. So we started a couple minutes late. So how about we steal a couple minutes from the I don't know, none of these questions are simple. so let's see. The first question was, you talk about building more positive childhood experiences. How can we as volunteers do that? It came from Liz.
Oh, well, I think all of the ways you can do that, right? Mentorship programs, after school programs, big brother, big sister programs. I mean, we know that a really compelling protective factor for children, even amidst extreme adversity, is having at least one adult outside of their home that cares about them, right? It can be incredibly powerful and protective for kids. So I just think all of that stuff, I just want us not to limit our minds to like the individual positive experiences. There can be community level positive experiences, again, through family resource centers or other kinds of supports in your community. That sets a landscape of positive community experiences. There can also be positive sociopolitical experiences like funding prevention. So I just think the same way that ACEs can exist in a family, in a school, in a community, in a country, the same is true about positive. So again, we all want to be in the business of preventing more of that positive stuff to really, again, set kids on a foundation, but also to then mitigate the impacts conferred by adversity.
Roger,
We'll do a couple of rapid fire questions here. Okay, so we've seen uptick on the number of children going into foster care with drug abuse leading the cause. What connections have you seen work addressing substance abuse issue? I think this is from one of my board members, from Jan.
I don't know that I heard the question, so now I'm trying to
What
scroll up.
connections have you seen work addressing substance abuse in relationship to
Oh, I think that providing access to mental health and substance use treatment is a huge one, right? So that gets into insurance coverage and healthcare coverage and all of those things. Again, you know best if that flies in Idaho, but certainly mental health is something that's underfunded in this country too. Given what a huge, enormous public health problem that is. About 9% of the adult population has major depressive disorder, and then some things, substance use disorder too. So I just think it's about, like, again, if whatever your outcome, I would call it, of interest is, right, preventing substance use, preventing opioid use disorder, but if you have healthier kids, you'll have less of those problems, right? If we invest in the work for a long time, if we really make those prevention solutions. So again, I come at it from now before substance abuse disorder, right, or substance use disorder, but I think you all know best about this. And I also think that's where, though, you have to think about the cycle of these things, the intergenerational continuity of not just adversity, but of poverty, of substance use and misuse, of all of these challenges, right? And until we insert those positive experiences, positive contexts to break that cycle, we see, the evidence is that you see the repeating of those same behaviors and health impacts.
I'm gonna give the last question to Shannon Fox, who is raising her hand, since her bravery will be rewarded.
Yes.
All right. Can you hear me okay?
And in terms of these questions, I will maybe send them on to Melissa. Maybe we could come up with some answers, and put them in the Padlet later.
Sure.
Okay.
Are you able to hear me, Roger?
I hear you, Shannon.
Perfect,
Okay.
Shannon.
Sorry, I just wanted to make sure. I'll always talk about this stuff as well, and I'm just here brainstorming and just really trying to process all of what you've been saying. And my question is, for what I've been looking into with prevention, there don't seem to be a lot of primary prevention jobs. And for the communities that I work in, every job that has a little prevention is it's a tiny bit of prevention and a lot of other type of work, which is really, really valuable work. But I'm an individual that's really trying to step into large scale community prevention and change. Yeah. And there's just not a lot of capacity for it. So what kind of things are you seeing in other states for primary prevention work positions that we could translate into this, into our communities of Idaho, or just in our communities in general?
I think it's a great question, but I think it's really true I'm sorry, my dog, of course, is going crazy right now, but I think it's really true to just the landscape and how we've always come at this issue. We've come at this issue from a treatment focus. And so we are now trying to kind of build the evidence and show what the prevention landscape can look like if we invest in prevention. So I would imagine through the Thriving Families Safer Children initiative, one thing is we are hoping to professionalize some of these prevention jobs, build a prevention workforce. I know that one of my goals as CEO is to have a fellowship program or something, building the next generation of researcher and advocate and practitioner in this area of primary prevention, because it really doesn't exist in spades, right? It's not seen as something, and it's also about us trying to get these issues into the credentialing and the educational system for pediatricians, for teachers, for some people have never heard of the ACEs study. Some people have never heard or just think it's that bad mom that maltreats her kids, right? And doesn't really get the great scope, the transcendence across SES. So I think family resource centers and those, they sometimes have one or two people employed. It's not seen as a thing that we can really impact. We almost have made it so that we think that prevention is not possible and that these things are inevitable, but we know that that is not true. So I hope that we'll start seeing, Shannon, more of these professional opportunities. But I think what you're seeing, it's not like you've missed it. It's that we really haven't developed that workforce in the way that we should. But thankfully, to Roger and to all of our Prevent Child Abuse state chapters, again, they are the boots on the ground. We are looking to them for their suggestions on how we can lift up these kinds of opportunities. I know there's a big conversation across the 10 evidence-based home visiting models that we're part of this model alliance. We meet monthly to be more collaborative and recognize that, again, we're only meeting 3% of the families that could really benefit. And why is that, right? And what is it? In part, it's that parents that graduate from our evidence-based home visiting programs want to become leaders in the field, and they want to go on to be home visitors. And how can we set the pathway for their credentialing and their professionalization of that, right? Right now, you know, if we only hire people that have a bachelor's degree, that's assuming that everyone has equal access to affordable college education, right? That's another theme. So maybe we need to, in the interim, you know, create credentialing programs or certificate programs to really, you know, honor the essential work that home visitors have done during this pandemic, while experiencing many of the same stressors as the communities of the families that they serve. So I think, again, I don't think you've missed it. I think we have work to do, and it's going to take all of us working together.
And I want to honor the fantastic work that Shannon Fox has actually been doing, you know, as a prevention specialist, but I know it's difficult to really have the kind of full-time work that, you know, some people would like to be able to do in this field. We need more of those, and really appreciate Shannon's work.